Good morning, friends, and welcome back to Pediatric Basics. This is third of our series for the picture of the month. This is actually a lie. It's not a picture, but there is an investigation report which we will discuss through. About a year ago, we had a couple of interesting clinical scenarios. So we'll just talk through these and discuss the investigation reports and then have a little bit of a talk about their problem. I hope you can see the screen clearly. So these two little children who presented at different times had more or less similar symptoms in terms of looking pale, tired and lethargic. One of them had a bit of a picky food habit and also had pica. There was no history to suggest at all that they had any bleeding tendency. So here comes the first question. What is the big difference between the two reports? And what do you think about it? Okay, why don't you pause your video and think about what is the diagnosis in little girl and what is the diagnosis in the young boy. So both of them, they have iron deficiency anemia. They responded very well to the treatment, and within few weeks of time their hemoglobin started getting better. We did not do any further investigation for those two children because we are confident. Iron deficiency normally presents with high platelet count, but occasionally or uncommonly it can have a low platelet counts. No bleedings have been reported in the patients who have low platelet counts with iron deficiency anemia. What are the possible differential diagnoses? Have you thought about it? Okay, what comes to mind? There are a couple of conditions. One is a rare scenario where iron deficient patient develops ITP. I believe theoretically possible. I have not seen any. And the other is the Evans syndrome, which is an autoimmune condition. I'm sure you're going to read about it today. Let's flick through the signs and symptoms of iron deficiency anemia. So tiredness, behavioral issues, they can have shortness of breath depending on the severity of anemia, palpitation, sore and enlarged tongue, which parents have reported at times. So clinical features of iron deficiency anemia: pallor, spoon-shaped nails, also called as koilonychia. They can have a splenomegaly, reported to be about 10 to 15% of iron deficiency patients. Blue sclera, which can be seen in other conditions as well. Think about it. And glossitis and enlarged tongue. So keeping it simple, that any condition which leads to reduced intake, nutrition, anything which loses iron like bleeding, especially chronic bleeding, all of the various conditions which causes it, reduced absorption in different gastrointestinal conditions, and as well as it will happen when there is an increased need of iron because of the growth spurt. Yeah, first is a confirmation of a diagnosis, and then the rest of the things are fairly simple. Nutritional diet and supplements. There are a couple of interesting associations with iron deficiency in children. One is breath holding spell and the other is febrile convulsion. If you know any more of it, please do let us know. Thank you so much for your valuable time. Please don't forget to watch other two videos if you have not already watched it. And then if you like it or any comments, please do not hesitate to share with us. Thank you so much once again.